The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USV, you before we, as USV.
USV, your reliable healthcare partner.
Hello viewers, welcome to this episode of Beat Diabetes. The focus of discussion today will be treatment of diabetes, and to help you understand more about that, we have a distinguished panel which has a combined experience of more than 100 years in treating people with diabetes. To my left is Dr. Jamal Ahmed, who for many years was the Chief of Endocrinology at the Aligarh Muslim University in Aligarh, and now is a consultant at the Diabetes and Endocrinology Super Speciality Center in Aligarh. We have Dr. Sudeep Chatterjee, equally renowned senior endocrinologist from the Park Clinic in Calcutta. And we have Dr. Prasoon Deb, who is a well-known endocrinologist from KIMS Hospital in Hyderabad. Welcome all of you. We'll start the discussion with Dr. Jamal Ahmed, and we all know that Indians are at great risk for developing diabetes. And we also know that diabetes has increased exponentially in our country. So what really are the risk factors that people should worry about when they think about diabetes?
You all know that diabetes is not a glucocentric disorder. It is a metabolic disorder that affects not only glucose metabolism, but protein, carbohydrate, fat, amino acid, and each and every metabolism in the body is disturbed. There are three main reasons which we call as a risk factor for one person to become a type 2 diabetic. 1. Change in the dietary pattern. 2. Increase in the adiposity. And 3rd, lack of exercise, what you call a sedentary life pattern. And the important modifiable risk factors are: 1. Increase intake of saturated fat in the diet, increase intake of refined carbohydrate in the diet, and the other reasons for modifiable risk factors are the lack of physical activity. The second important risk factors, what you call as unmodifiable risk factors, the factors which you cannot modify, like aging. After 45 years, the person is at increased risk for becoming a diabetic. Family history, genetics, 25% individual, if they have got a family history of diabetes, they become diabetic in future. So, these are the factors which we cannot modify. It is a fact that we have to accept it.
So, thank you Dr. Jamal Ahmed for this very elaborate and self-explanatory answer. We now actually move to Dr. Chatterjee. When a patient comes to you with diabetes, how do you decide what kind of treatment the patient needs?
Basically, diabetes treatment is personalized medicine at its best. Now, if the blood glucose is very high, say over 300 milligrams per deciliter, then the treatment of choice is to start straight away with insulin. And if it is not so high, which is the usual case, then we have a choice depending on the situation. We start with either just lifestyle modification, exercise is to be stressed, and if you can do no exercise at all, then at least you can walk. Now, apart from lifestyle, then the next thing is that the patients always are concerned about their diet, but the diet is getting less and less important as we are learning more and more about our diabetes. Now, in terms of tablets, there are a variety of tablets in the market today, and every single tablet that is available abroad is available in India to us. I think the first consultation with the patient is very important, because the patient has to learn that although the disease is silent, it is causing harm silently, and this awareness has to be there. Because if the blood glucose is say 300 or if the blood glucose is say 100, you don't feel very much different. But you have to realize that a commitment to a good lifestyle, weight control, exercise, regular checkups. These things are very important, and this should be actually dealt with right in the beginning.
Very true. I agree with you. In addition, some of us or some patients may actually require insulin right at the beginning for various reasons. So, Dr. Prasoon Dev, one of the main concerns that patients always have is that I'll get a low blood sugar, and this low blood sugar, also called hypoglycemia. What's this all about? Is this concern real, and what can we do about it?
Yes. The first thing that all patients need to understand about hypoglycemia is that it is real, it happens. When your doctor is trying to bring down the blood sugars to normal, hypoglycemia might happen. The idea is not to be worried about this, the idea is just to be aware about this. The second thing that all patients should understand is that hypoglycemia is the only diabetic complication which the patient has to treat himself. All the other complications your doctor has medicines for, tests for, but hypoglycemia is something that all patients should understand properly from their doctor and learn how to treat it. The third point is your close members, people whom you interact with every day, should also be on board about hypoglycemia. If you have a hypoglycemia and you are unable to take care of yourself, then your parents, your wife, your children are the people who will be taking care of it, and they absolutely need to know about hypoglycemia. They need to know the symptoms and they need to know how to treat it. The fourth thing is you should know how to treat this hypoglycemia, and the simple problem is that your body has less glucose, and the simple solution is you give it more glucose. The easiest thing to do is take a cup of water and add 2 teaspoonful of glucose powder or even plain table sugar and drink it. Then eat something also, because this sugar will only last for a short time in your body. Remember that the tablet that you have taken in the morning is still working, and you might actually have a hypoglycemia again after 1 hour or 2 hours. So, it is important to test yourself once more, at least 1 hour after you have treated yourself. Lastly, if you have hypoglycemia, just one episode of hypoglycemia might not require you to change your medicines, but if you find that you are having more than one episodes, it is important that you go back to your doctor, discuss your treatment with him. So, your doctor might want to change the treatment that you are on, reduce certain doses, change you to a newer molecule.
Thank you, Prasoon, for explaining this so well. And really, one important point is that if you take your medicine on time and eat on time, if you maintain timings, then hypoglycemia becomes much less likely. So, I think that's an important point. In general, aerated beverages are a no-no for diabetes. Even if you're talking about fruits, it's okay to have a fruit, but not to have fruit juice. So, some things are not good food for diabetes. Obviously, sugar is not a great thing, but hidden sugar that we see, that we don't see, that is present in our white bread, for example, that is present in our sort of refined wheat flour, in our polished rice, those are all sources of refined processed sugar, carbohydrate, and they really should be minimized and moved to higher fiber carbs if we have to use them. We need also to ensure that we have adequate protein. If we follow these basics, then we can manage our diabetes much better. We'll take a short break now. Stay tuned, because we have some really exciting stuff after the break.
The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV, you before we, at
USV, your reliable healthcare partner.
Welcome back after the break. We had promised you something exciting, and we have a quiz contest for the studio audience today. We thought of doing this to gauge the level of awareness and understanding that the audience has about the management of diabetes. At the start of the show, we conducted a lucky draw from the audience members and selected 4 of them for this quiz contest. Let's get to know our contestants.
Hi, my name is Neeraj and I have had diabetes for the last 12 years. My diabetes is fairly well controlled now. It is a combination of medicines, diet and exercise, and you have to find the right balance between the three for yourself, what suits you.
My name is Romi Juneja. I actually had an attack of pancreatitis, and as a result of that was an acute level of diabetes. So it's been almost 12 years since I'm on diabetes. I have been an active sales and marketing person, but what I have figured out for diabetes is that if one keeps a very good control on diet, which I actually do, also doing exercises very regularly.
Hello viewers and friends, I'm Hina Bijli. Basically, I'm an academician by profession. I was diagnosed with diabetes a few years back. I balanced my diet with low carbs and low fat and frequent meals most of the time. I'm a successful professional today and I have learned really well how to manage my diabetes.
Hi, my name is Deepak Madan. I was diagnosed for diabetic 15 years ago. I'm 54 years old. I think regular monitoring, diet modification and daily exercise is a key to keep your diabetes under control.
Before we start, we need to understand the rules of the game. There will be 5 questions. Each question will have 4 answer options. The contestants will be given voting pads having options A, B, C and D, and the contestants will select one right option, either A or B or C or D. Every right answer will get 10 points. The wrong answer will get no points, but there's no negative marking. The total score for all contestants will be displayed at the end of the contest. The one who gets the highest score will be declared the winner, who will be given a prize. But we really want all of you to be winners. We really want everyone should score the maximum. That's the idea of this quiz. So the first question displayed on your screen is food such as beans, leafy vegetables and berries that are slow to break down into glucose are said to have a low A. insulin level, B. water level, C. glycemic index, D. protein level. Please punch in the right answer on the keyboard. Most people said glycemic index, that is C. And the correct answer is C, that is glycemic index. And I request Dr. Jamal to explain that a little bit to our audience.
Yes, happy to know that you have pointed out the correct answer. You know what is the low glycemic index means? The items which you consume, they are broken down slowly into glucose so that it gives rise to less rise in the blood sugar. And these items, some of them they are already mentioned: green leafy vegetables, beans, legumes, plain milk, plain yogurt, salads, particularly tomatoes, cucumbers, and the other items which have got at least 15 to 30 gram of fibers. Some of the fruits mentioned already, like apple, the berries and oranges, they are good choices. So, they should be consumed in the moderate amount.
So what you're explaining really is that glycemic index is the rate at which the glucose rises after you have a particular food, and substances with more fiber, like the ones mentioned there, actually have lower glycemic index, and they're always better for diabetes patients rather than taking things with a high glycemic index like refined carbohydrates. We move to the next question now, which is displayed on your screen. A person's blood sugar is 65 milligram per dl. He is feeling clammy, sweaty, and is even shivering. He has symptoms of A. high blood sugar, B. hypoglycemia, C. high blood pressure, or D. diabetic neuropathy. Punch in your answer now. Wow, very impressive. We have a very learned audience there. Congratulations. All of you have got the right answer. And I'd request Dr. Chatterjee to explain a little bit about the correct answer, which is B, that is hypoglycemia. Dr. Chatterjee.
Congratulations, you've got it right, because first job when you feel that you are hypoglycemic is to correct the hypoglycemia, or you might need the help of somebody to correct it, that's fine, but get it corrected fast. Once you have got it corrected, then you think whether it was an explained hypoglycemia like you had a delayed meeting, or you delayed your lunch, or you had some other problem, or you took your insulin and forgot to have your breakfast. If it is an explained hypoglycemia, fine. If it is an unexplained hypoglycemia, it's not so fine, but please be sure to tell your doctor about it.
We move to the third question as it opens on your screen. And the third question is, which of the following is not a major risk factor for type 2 diabetes? Options are A, obesity, B, exposure to hot climate, C, family history of type 2 diabetes, and D, age older than 45. And press in your answer now. This is a very, very impressive audience. The correct answer is B, exposure to hot climate. Quite clearly, exposure to hot climate per se is not a risk factor for diabetes, but the others probably are. Dr. Deb, you want to explain that?
Yes, just going down that list, obesity is a clear risk factor. In fact, one of the ways that you can control your type 2 diabetes is by controlling your weight. The second is family history, again a very important risk factor. The third point is age, and that is also important. The older you are, the higher the chances of your diabetes. In fact, 45 years is generally accepted as the cutoff after which you should start screening yourself. Even if you are not a diabetic, you should start screening yourself at the age of 45 years. So, the only answer which did not fit into that list was hot climate. Hot climate per se has not been shown to be associated with type 2 diabetes.
So, very interesting. A lot of people feel that it's something to do with the climate, that we have more diabetes, and while there may be some role of pollution in this, climate per se has not been shown to contribute majorly to the risk of diabetes. Moving to the next question. If you have type 2 diabetes, you may need oral drugs only, oral and injectable drugs, oral drugs and insulin, or any of the above. Please punch in your answer. And the right answer for question 4 is option D, any of the above. You could require oral drugs, you could require insulin, you could require both of them, even if you have type 2 diabetes. And I think all of you have got it right. And really, I think either the questions are too easy or the audience is too bright. So this is very, very impressive. Yes, Dr. Jamal, you want to explain that a little bit about choice of therapy?
Yeah, I think you are right in the sense that the drugs are helpful in treatment of type 2 diabetes for a few years, and after that there are people, especially when the duration of diabetes is more than 6 years, or the person has started taking more than 2 drugs, we try to educate him that this is the right time, and particularly if the HbA1c is more than 9% despite taking 2 drugs, now you have to take insulin. So, along with the oral hypoglycemic drugs, we combine insulin just to make the target what we are going to achieve for the management concern. And lastly, when the person become diabetic for more than 10 or 12 years, majority of the people may not require any oral hypoglycemic drug except metformin, some of the newer oral hypoglycemic drugs available, DB4 inhibitors. Otherwise, the person just needs treatment, what you talk about the treatment of type 1 diabetes, that means 3 or 4 injection of insulin per day. So, in that sense, congratulations, you are all correct.
I think it's very important to understand, people often ask this sort of broad question, are oral medications better or insulin better? Really, it depends on where you are, it depends on what kind of diabetes, what stage of diabetes. So, really you have to depend on your doctor. Let's move to the next question now. People with diabetes are at a risk of hypoglycemia or a low sugar reaction. A, if treated with drugs or insulin. B, only if treated with insulin. C, only if treated with oral drugs. D, or when they are on a strict lifestyle, diet, exercise schedule. Punch in your answer now. So we have interesting variations here. The correct answer is whether you're on oral drugs or on insulin, you are at risk for, you could be at risk for hypoglycemia. The correct answer will be A actually, and quite clearly only one of us have got that right. So I'll really need Dr. Sudeep Chatterjee to explain that.
Actually, there are drugs that do not generally cause hypoglycemia. So perhaps that is one of the reasons why people feel that no drug causes hypoglycemia. That's not correct. There are several drugs that can cause hypoglycemia, and of course insulin can cause hypoglycemia as well. But you have to be aware of it, and you must realize that if you're a diabetic patient, you are likely to get hypoglycemia with either some drugs or with insulin at any time in your diabetic career.
So both oral medication and insulin can cause hypoglycemia, although it's almost impossible to get hypoglycemia if you're only on a diet and exercise schedule. Very rarely it can happen there too, but it's not common at all. Dr. Prasoon, you want to add something there?
Yeah, we have touched on hypoglycemia quite a number of times today. This is something that you should be aware of. You should not be scared of it, firstly. Secondly, do not under any circumstances try changing your medicines or stopping your medicines because you have a hypoglycemia. Talk to your doctor, let him reschedule your doses. So, once you have a hypoglycemia, A, know what hypoglycemia symptoms are, B, know how to treat them, and C, take your doctor's help about rescheduling the doses. There are plenty of newer molecules that we have now which do not produce hypoglycemia per se, but don't become afraid of low sugar and keep your sugars high. That's not going to work in the long run. So
thank you, Prasoon. It's very, very important point. Most low blood sugar reactions or hypoglycemias can be traced back to some aberration in the diet or timing, and we need to correct that before we start modifying drug treatment.
Yes.
A wonderful point. Thank you very much. We now have the results for the winner for the studio audience quiz, and the winner is Hina Bijli, who got all 5 answers right. Congratulations, Hina. This is wonderful. Delighted. So the quiz for the studio audience is now over, but we have a question for all of you sitting at home who are watching and supporting this program. You're an integral part of the show. You can test your awareness level about diabetes by answering this simple question. How does exercise help people with diabetes? A, it improves oxygen flow. B, it lowers insulin resistance. C, it decreases blood sugar. Or D, all of the above. Out of the 4 options shown to you, please SMS the choice of right answer to the phone number displayed on the screen. Polling lines will be open till Monday 12 p.m. The winner will be declared in the next episode by a lucky draw from the right answer.
The winner of Beat Diabetes Episode 2 viewers' question is Prakash Chandra Shetty from Belgaum.
So we come to the end of this program. I would like to thank our panelists for being so gracious to give their time here, our wonderful contestants who did a great job, the studio audience, and all of you sitting at home who participated in this. Thank you very much.